without objection.
Mr. President, I come to the floor today to speak about the Supreme Court ruling on health care. Obviously, we were all glued to the television set this morning and watching this historic and momentous decision. I was deeply disappointed with the ruling. I respect the court and its work, but I was disappointed the court failed to strike down this law, as many had anticipated that they would. I was disappointed because I believe that the law has been deeply and fatally flawed from the very beginning. It became a major issue, of course, in the 2010 election as people watched in 2010 this being passed through without bipartisan support. It was procedures were worked around and violated in order to pass it through. The stories are rampant about how, against really the will, I think, of the majority of the American people, this 2,700-page monstrosity, so infamously described by the Speaker, then Speaker of the House, as something that we'll learn about after we pass it. Well, Mr. President, we've learned about it. We've had 2 years to examine this, and we've seen it, parts of it being played out with more to come. And what we've learned, I think, is that this bill is fatally flawed, that it ought to be repealed. It doesn't mean that we don't have health care issues that we should deal with, but we need to deal with this in a bipartisan way that's better explained to the American people, that's cost affordable. It's labeled the Affordable Care Act, and it's anything but affordable. At a time of deep recession, at a time of over a period of the last 2 or 3 years of a stagnant economy, this is adding a burden of regulation and taxation that is working against our coming out of this deep hole of economic distress. Americans found out what was in this bill, and it reaffirmed, I think, many of their deep concerns about going forward with a plan that tries to wrap up the entire U.S. healthcare system in one big ball, 2,700 pages worth of rules and regulations and taxes and impositions and mandates, and said, this is not, we want reform of our health care. We want to make it more affordable. We want to make it more accessible. But letting Washington essentially decide how to go forward with that without giving flexibility to the states and flexibility to the private sector to initiate reforms clearly was not what the American people, or at least the majority of the American people, were looking for. Despite the promises that were made about the impact of this bill by those who authored it and by the President, middle-class Americans have found that the health care law is a massive tax, and of course the court reaffirmed that today. This is not just a penalty. This is a massive tax on working Americans, and not just the rich. It's on the middle class, and it's on every American taxpayer. Even though the President is famously now on every YouTube and every station that's discussing the healthcare system, his quotes insisting that this was not a tax on the middle class or a tax on any Americans. Families have found out that their insurance premiums are going up, not down, as was promised by those who supported this bill and authored this bill. Seniors have found out that they may not be able to keep the insurance plan that they have and want, and could lose access to Medicare Advantage. Medicare Advantage, a program that many seniors have enrolled in and found to be successful in addressing their health care needs at a reasonable cost. Business owners found out that they would be fined $2,000 per employee if they failed to provide workers with a health care insurance plan approved by Uncle Sam. I don't know how many business owners I've talked to in Indiana in this past couple of years who basically have said, we have sat down with our employees and discussed with them how much we were able to do and still keep them as employees and not sink this company. And we have come to agreements, and different companies have different types of agreements with different types of plans based on their ability to provide that kind of coverage, accepted by both the employees and the owners of the business. And now all these are wiped out because it's determined that Washington will decide what the minimum level of the plan should be. And several business owners have told me that they simply can't run their business in this economy on the low margins, if any margins, that they're achieving, and provide that kind of increase in insurance and have to pay for that, or opt out of it and pay this fine, $2,000 per employee. Other businesses have said, you know, well, okay, there is a exemption for those of under 50 employees, and other businesses have said, guess what? I've got 47. You think I'm going to hire over 50? No way. No way am I going to push myself into the category where I have to pay a fine of $2,000 per employee if I don't comply or with the dictates out of Washington, D.C. in terms of what my plan should look like. And so what we see is a lot of hiring of temporary workers. We see a lot of hiring, payment of overtime for existing workers, but we don't see hiring. We don't see the expansion of hiring, particularly in small business, because of the so-called Affordable Care Act. Patients and doctors, and I've talked to them all over the state of Indiana, healthcare providers, insurance companies, hospital administrators, groups of doctors that are part of a group, or those individual in private practice, and all the other entities that are engaged in healthcare. And to a group, they have major concerns with this. And to a group, they have opposed this Affordable Health Care Act, or so it's described. We have a dynamic medical device industry in Indiana, as they do in several states across this country. It's one of the cutting-edge, leading industries in terms of our ability to provide new products, innovative products to make people's lives healthier and safer, and to prevent a number of unintended consequences from various medical procedures. They learned, after reading this act and finding out about this act, that they were going to be subject to a tax just levied on them, a 2.3% tax on their gross receipts, levied on them because they were a pay-for this. These companies who make pacemakers, artificial joints, surgical tools, find this as something that drives them to the point where they need to think about transferring their business overseas, or part of their business overseas, or not hiring the workers that they would like to hire. It is simply a tax imposed on one of our more dynamic and innovative industries that is leading in our exports, but no longer can compete under this tax with their competitors that are based overseas. Now, just because this ruling happened today, and saying that the health care law is constitutional, does not mean that it's the right policy for us to go forward. The law remains unpopular and unaffordable, and I want to state here today that I am committed to working with my colleagues to repeal the health care law and give our citizens the power and the flexibility to make their own decisions relative to their health care, and to use those innovative ideas that are out there to put a much better package together that addresses the real question of rising health care costs and access. As I've traveled our state, as I've listened to all these providers, as I've asked the question of them, if the health care law is struck down by the Supreme Court, what would you propose? Because we have a problem here. We have rising health care costs that have to be contained. And yet we have an access problem, and we have a number of other problems in terms of gaining access to coverage and payment for health care issues. What would you propose? And I've got a long list of those, and I've talked about it here on the floor. I talked about it during the campaign. I've talked about it across the state. Things I have learned from listening to the people who are on the front line doing this business every day. And there's all kinds of innovative solutions out there. There's all kinds of things that we ought to be looking at. And I know all of us are committed to going forward those who support the repeal of the current law going forward to bringing forward a sensible, affordable, cost-effective, quality-effective solutions to our health care issues. So what the Supreme Court essentially has done is said, Congress, it's yours. And Congress represents the people. And we need to be representative of the people. And so what we need to do now is listen to the people. And it's the people who will decide the future of health care for this country. It's the people who will decide in this coming election, I believe, the people who will decide as to whether they want ever more Washington, ever more taxing and spending, ever more deeply in debt, ever more federal mandates and regulations, or whether or not they want to approach this in a different way that can reduce spending, empower individuals, give states greater flexibility, and bring forward sensible, step-by-step, incremental, as it's affordable, tested, proven ways of addressing our rising health care costs. And so, perhaps, rightfully so, the Supreme Court has turned it back to us. And it's our responsibility now to go forward and represent all those who were not listened to when this bill was run through this Congress in a way that violated a lot of our procedures, in a way that went against, I believe, the majority will of the American people. So here we are, and now it's back on us. And we need now to stand up and take responsibility. Those who voted for it will be defending it, of course. And those who voted against it, or those of us who are here, partly because it was an issue in the 2010 campaign, are here to not just simply say we don't like what's there, but to offer also positive solutions to the problem. Mr. President, with that, I yield the floor.